Okay, hello everybody. Welcome to another Medical Projects webinar. It's a couple of minutes past now. Just waiting for the last few students to log in, but we'll get cracking anyway. Yeah, thanks for joining us this evening. I appreciate it's feeling a lot lighter and brighter outside, and summer's almost on the horizon now, which is really nice. So really appreciate you taking some time to tune into one of our webinars. My name is Mark Williams. I work here at Medical Projects, and we help students with their work experience and get places at medical school. So tonight we are talking about how to use summer to boost your medical school application. Like I said, it's kind of on the horizon now. You need to kind of start some of the planning things now. People are starting to think about their summer work experience now. So we're just going to go into detail a little bit about planning it, finding it, getting work experience, and then kind of making the most of that work experience whilst you're on it as well. The structure of tonight will be kind of 20 minutes discussion, and then we'll have maybe 20-25 minutes at the end where we open it up to your questions as well. We want to try and make sure that we get through as many questions as we possibly can, give everybody the chance to ask all the questions they want about work experience. Cool. So just a bit of housekeeping and introductions. This webinar will finish within the hour, so before kind of 8 p.m. We will send a recording of it to everybody as well via email, and we'll send a copy of the slides and any links that we kind of mention in here as well. We'll send that out to you in an email, probably tomorrow, maybe Friday. We'll have a Q&A at the end. We use the Q&A function on Zoom. And if you've not used the Q&A function on Zoom, there's like an upvote system. So you can basically, if somebody's asked a question that you also wanted asking, you can just hit the thumbs up button and it brings the most popular questions to the top. We'll use a couple of polls as well this evening. That's just for us to gauge kind of who's watching this evening. Just helps us kind of pitch the level of the conversation to kind of be the right level. And yeah, super interactive. We'll try and keep it as fast paced and as engaging as possible. So let's crack on and start with the first poll. So first one is just to work out kind of who is tuned in, what kind of stage everybody's at. I would suspect that most people will be in year 12 or whatever the equivalent is if you're in different countries. So we'll just give everybody a second to answer that. Cool, looks like most people have done that. I'll share the results. It's all anonymous, but this just kind of gives you an idea of who's kind of on the webinar as well. So yeah, 77% are in year 12, which we would expect. 18% in year 11, great, you're ahead of the game. But you can still use your summer to be finding work experience. That's great. And then a few people kind of year 13 or other. Cool. And the next one is one we always like to ask as well, just to see if people are coming back and actually watching more webinars or not. So basically, how many have you attended before? Just lets us know whether we're kind of on the right tracks and people are coming back and enjoying the webinars, or whether they hate them and they never come back again. We'll see. Cool, so most people have voted there. So yeah, 44%, this is your first one, awesome. Welcome to you guys. Hopefully you enjoy it. Hopefully we can teach you a few things. And then the rest have all kind of watched before, which is awesome. And nearly 20% have watched 5 or more. So yeah, really appreciate that. That's nice to see. Cool, so what we're gonna be covering this evening is kind of how to find work experience, how to apply for work experience, what to do during work experience, and then how to reflect on the work experience as well. So we just want to cover those 4 really key steps and give you some really clear guidance, some really useful tools to take you from having no work experience to finding it, getting it, and reflecting on it properly. And if we can do that in the next kind of half an hour, then we've done our job really well. Cool. So I think this would be a really good time to introduce Minnie. Minnie's joined us on lots of webinars before. Hello, how are you?
Hello, I'm good, thank you.
Are you enjoying the nearly summer, kind of the brightness that's back in the evenings now?
Yes, honestly, it's the happiest thing. It's so nice to have a bit of normalcy and sun back.
It just changes like everybody's
It
mood, I think.
does.
It's
Honestly, it's
great.
just so much better.
Yeah, I think we should just all live in a permanently sunny
Yeah,
country and just everyone would feel great.
I think it'd be much nicer.
So tonight we're kind of talking about work experience and summer work experience. So the fact that it's nice and sunny outside means that we can, we're almost there at summer now. So we're going to be looking at what we can do to find work experience and get work experience as well. I don't know if kind of thinking back to when you were year 12, did you kind of use your summer to kind of bulk up your work experience back then?
Yeah, I tried to. I was doing a lot of volunteering at a hospice near me, so just picking up shifts there, handing out drinks and stuff, which was really nice actually. And then just that trying to get some shadowing, which is really difficult to get a hold of, but once you get it, it's like a really good addition to a personal statement and stuff. So hopefully you'll get some tips on trying to find it this evening. So yeah, no, but it's enjoyable. It's good to actually get a bit of hands-on experience in medicine before you actually go and apply to it.
Okay, cool. I think I'll jump in with certain like bits of tools and things. So if I kind of jump in at any certain points, it's just because I kind of want to throw in some like a document or a tool that'll be useful for the student. So I'll let you crack on, and then I'll just kind of jump in with those bits as and when, if that's okay.
Sounds good.
Cool.
Cool. So what counts as work experience? I feel like everyone just assumes, not everyone, but most people assume you've got to be shadowing, you've got to be in the hospital, you've got to be with patients. It's actually not the case. Although like that is great, that's amazing as well. But there's actually a broad range of things that you can undertake that actually count as work experience. So as I just mentioned, so you've got hospital and GP shadowing, where basically you'd be maybe following around a doctor, seeing what kind of role they have, on the day-to-day on the wards, sat in a GP clinic, seeing how they, approach dealing with patients and seeing what their job involves day to day. It's all really great stuff. And then there's volunteering as well, which is really nice. It's a bit more independent, a bit more hands-on. And they look at that really, really well on personal statements and things like that. So you can do that in a hospital. If you maybe serving drinks to patients or just helping out around the hospital and little jobs. A hospice as well. That's a really good place to be. Really just nice, sort of caring old community. It's a really, really good place if you want to volunteer there. And care homes as well are a great place to go and volunteer at. Paid work as well will count. So HCA, which is healthcare assistant. So I think you probably have to be a little bit, probably 18. So any of you that are maybe thinking of taking a gap year or are on the older side, having a think about that, and working in a pharmacy maybe as well would be a really good role for you. And any public facing role as well. I think especially with the COVID situation, I think that medical schools are much more much less focused on having specifically healthcare related work experience. They just want to see that you are committed to a role if you're doing it in the long term, and that you are a good communicator, you can work in a team. So things like working in a shop or a restaurant, anything public facing where you're speaking to people and speaking to members of the public are great things to put down in your personal statement and talk about in interviews. And work experience and courses as well. So again, COVID has made it really difficult. So there's a lot of great courses out there that are online as well, just to help you get a bit of experience that you can put down on your personal statement. So I'll hand over to Mark, who is going to talk about medical projects work experience.
Yeah, I mean, I know a lot of people were struggling to get work experience, especially over the last year or so. And I know that things are starting to change, and people are managing to get back into GP practice and things. But the online courses that we've been running have been amazing. So we have our ward round live, where you can kind of speak to patients on the wards and kind of under the tuition of under the guidance of a doctor. And the same with the GP Live course as well. Again, speaking to patients, kind of taking patient histories and working through medical cases and things. And the same with kind of the virtual work experience week. I'll mention the offer and stuff like towards the end, but it's just to kind of touch on the fact that there is a lot of online work experience still available. So if you're starting to get a lot of no's for the work experience, when you try in GP places and that, COVID's still a bit of an issue, then there are just options out there, but I'll mention it towards the end as well, once we've kind of got through a bit more of the gritty detail of applying.
Cool. So yeah, obviously it's quite hard at the moment to get hold of work experience, but I think with the fact that maybe it's easing up a bit in terms of the COVID situation, that they might be starting to, have people apply for roles and have roles available in hospitals and places. So in that case, if you've got any contacts in the hospital, absolutely great. Get in contact with them. That's probably the easiest way, if you're lucky and have someone who works there, and just be cheeky. I mean, I got my work experience. I played tennis with one of the consultants and just asked him, and just went to spend the day in clinic with him, and that was all I needed. But obviously, I know everyone, not everyone's going to know someone that works in a hospital. So next step is probably asking your school as well. They might have some contacts, or might be in touch with maybe the hospital, or have had people, go over and do work experience before. So it's worth asking them, and they might point you in the right direction. And visiting trust websites as well. So checking out your local hospital. They have a lot of some information on careers and starting out your NHS career, and probably have a work experience page as well, where they might have an application, which I'll talk about later on. So that's probably your next best bet. And volunteering as well is contact your local volunteer centre. So they will point you in direction of any roles that are suitable for you, because obviously, you guys are 16, 17, so some things are going to be, off the cards, but they'll be great in sort of helping you out and find a role that suits you. And also roles within the NHS as well itself. The NHS England have said that they might appear on NHS Jobs as well, which is sort of its own website where they advertise for just like even doctors' posts and nursing posts, but voluntary jobs do sometimes pop up there as well. So it's worth keeping an eye on that. And another thing NHS England recommends is having a look on this Do It website, which has loads, I checked it out today, loads of volunteering roles, where basically whatever you want to do, it's on there, whether it's sort of a caring role, whether you're going to sort of go and volunteer and just have a chat with maybe elderly patients in care homes, or whether you want to work with children. There's loads of stuff on there, so check that out. And so as I said, the trust websites often have application forms, so it makes it really easy to just fill that out, and it gets sent straight to whoever the volunteer coordinator is there. So before you start sending off emails, things like that, and phone calls, just check if they've got an application form, because it's probably the easiest thing. Contact the work experience coordinator themselves if there's not an application form, or education department. Just practice sort of, writing formal emails. I know, Mark, did you say that you might have a sort of email?
Yeah, so we've got two things that we've created to help for this actually. Can I share my screen? I might just try and bring it up on the screen so I can actually explain it, and then I'll send a link to it as well, and then it should be accessible to everybody. Right, let's see if I can make this work. So if I can share this screen, just let me know. Can you see?
Oh, yeah, I can see that.
Yeah, okay, cool. So essentially this is part one. So if you're drafting any emails, this is literally a really good template, because I know sometimes people are like, oh, go and apply for work experience, and you're like, right, okay, what does that actually mean? Oh, we'll send some emails to this person, send an email to the work experience coordinator. But that doesn't actually tell you what to do, and there's not an actual template that I've seen out there. So we've created this work experience email template. And what I've done is I've broken down every single section and said why it's good and how to structure it. So even just things like making sure you get the subject line right. I know it sounds simple, but the amount of people that miss it, it's just basic. So use this document. I'll send a link to it in the chat in a second as well. And just making sure it's structured professionally. I think, like you mentioned, Minnie, the fact that, we don't, or when you're in kind of college and sixth form, you're not sending professional emails to doctors and to secretaries very often. So just using a nice template like this will just help so much. Don't worry if you can't see it on your screen kind of at home. If you're on like a laptop or a phone or something, I'll send you a link and you can literally download this and use this. So I'll give you the link for that one. And you mentioned as well, kind of speaking to work experience coordinators or calling people as well. So what we've also done is, because this is like the absolute worst part, is if you have to ring somebody up and you have to have a conversation with somebody on the phone. Like, I still hate doing that.
Yeah, it's awful. Yeah. Especially that age, I was terrified. So
it's just not a nice
know
process.
What you're saying. Yeah, it's like planning ahead and knowing what you're saying. It just makes it so much nicer because
so we've written a script. We've literally written a script on how to kind of be proactive and kind of make those first few phone calls. It's not nice making phone calls. So if you've got a script and something to work from, then at least it makes it a little bit easier. Again, don't worry if you can't read this at home. We'll send a link to this as well. I'll put them both in the chat, and you can download both of those for free. So I'm going to post them in the chat now, but I'll let you kind of right, I'll wait until the end, actually, once we've been through all the documents, if you want. And I'll just put all the links in one place.
Yeah, perfect. So, get that email just spot on, because it just means you make a really good first impression as well, and it make you seem really professional and key, and they're probably more likely to have you. So, have a go at that. And writing a CV as well, having just loads of copies at the ready, even if maybe you're going for just a job, restaurant, or a shop job. If you're struggling to find actual like hospital GP work experience, then I just would go around and give out my CV and see who gets back to you. And it's writing a CV is really difficult, so just do loads of drafts and get it spot on, and then you'll be sorted. Okay, so what to do when you are actually on your work experience? So one thing that's so important is actually introducing yourself and just being enthusiastic when you do, making a good impression, because I think that's the one thing that even at medical school, it's so important, is just going in and just saying, hi, my name's so-and-so, and I'm here on work experience. Can I shadow you? Can I help you with this? And it just makes it really clear that you're keen to be there, and they know who you are. So if they're going to go and do something, they maybe are going to ask you to go and watch, then they'll know to come and get you. Take notes as well. We'll go over that later, but you really want to reflect. The most important thing about work experience is being able to reflect on it and write about it. So taking notes while it's fresh in your mind, while you're there on the day, is so important. And then chatting to the staff there if you're on a hospital GP placement, because this is something that I'll probably ask you about in interviews, is what are the best parts about being a doctor or nurse, or what are the challenges, because it's not all rainbows and sunshine. There's challenging parts of the role, and they want you to know about that as well. And the best people to ask are the people that are actually doing the job. So just ask them. They're more than happy to chat with you. So yeah, go for it, and just be proactive and get involved as much as you can as well. And ask if you can help with things, and offer to help. This is a top tip, especially when you get to medical school, is that it's a lot of things is like a job for a job. So if you maybe offer to help, maybe go get them a coffee from the staff room, then they are much more likely to, do you a favor and, let you, well, I don't know what they let you do, like put a blood pressure cuff on someone, or, let you listen to their heart with a stethoscope. Then, yeah, just be as friendly and keen to help out as possible, because that will, get you places.
Yeah, I was going to say, I think it's important that that idea of one, introducing yourself. We could do an entire webinar on
Yeah.
introducing yourself and the importance of that. But yeah, being proactive and being helpful and getting stuck in. As soon as you kind of go into the world of medicine, things are no longer spoon fed to you. When you're at kind of school and college and sixth form and things, everything's just kind of quite often is presented in a way that makes it really easy to process and do. And I know it doesn't feel like that sometimes when you're in college and sixth form, but compared to when you go into medicine, you have to make all of those things happen yourself. Mm-hmm. So if you're not being friendly and you're not being proactive, and even just offering to make cups of tea, like you won't get as far. But as soon as you start, can I make everyone a cup of tea, or I can see there's a patient there, can I just go and have a chat with them and find out how their day is? And just that tiny little bit of initiative and proactiveness. I don't know if that's a word, but I'll coin that. It will just open all the doors. So get used to that mindset when you go in. Right, I have to get involved with things. I have to offer to help, and it will just open everything up for you.
Definitely get used to like being annoying, because I mean, you need to get out of this what you can, and do all the stuff you need to do. So just ask, because it's your time. You've got limited time there. You want to get out as much as possible. So just be annoying. And then how do you reflect on work experience? So we've got loads of stuff on this, loads of articles, and I think we've got a webinar coming up on how to reflect. But yeah, just make sure on the day, take your notes, and then have it fresh in your mind, and then maybe give it a day or two, and then no longer than that, and then write up a good reflection, because you don't want to leave it for ages where you're trying to think back on what actually happened and you're kind of starting to make stuff up. Yeah, do it while it's fresh. So the structure that we even use at medical school, I think, I'm pretty sure doctors use to up to consultant and beyond consultant level, is so what happened, what went well, what could be improved. So what happened, just like summary of the event. Let's say you chatted to a patient that was really sad or upset because they were feeling unwell, and who was involved. So you were there, the patient was there, and the nurse was there as well. But make sure it's anonymous. Don't include any names or anything that could be identifiable, because it's not good. And then what went well? So what did you do well? Maybe you showed a lot of empathy with the patient. Maybe you were really proud of how you communicated, and write that down, because I mean, it's always good saying I could have improved on this, but being able to highlight what you did well is so important, and then there's a lot you can take away from that. And obviously, yeah, as well, what you could improve upon. Maybe you need to show more active listening, or maybe you could have gone and got a member of staff earlier, anything like that. I mean, whatever had happened, and just yeah, think about it, think back, and what could you have changed. And then another important thing is action plan. So what are you going to do next time, and what are you going to do in between now and next time? What are you going to do to improve? So maybe you will read a book about, say you work in a hospital, about palliative care and approach towards patients, so that next time you know a bit more about the overall care of patients, so that you can better sort of approach the situation and approach patients. And yeah, so you can literally write anything as long as it's sensible and as long as you can back it up when asked about it in interviews and things like that. But it's a structure you really need to get used to writing, because you'll be doing a lot of it in medical school. I think is that the last slide?
Just on those 2 points. So one, you were saying you need to write everything down, or write as many notes about what you're doing. And then the second part was the reflection part and learning how to reflect on it. We've done webinars on reflection before. We'll do more webinars on reflection in the future, because it is like, it's the secret, it's like the key to getting a place at medical school, and not many people do it really, really well. So we bang on about it all the time. There's, I think, 65% of the people watching this will have heard us say this a million times before.
Many times.
So what we've done is we've created a table to help with that reflection sheet. This is the same table that we give out to students that join our courses, actually. So we're going to give this out for free as well tonight. So let me see if I can share this. Share screen. Let me know like when you can see that. Yeah. Okay, cool. Like, it's a really, really basic, like, first step to reflecting. If you've never done any reflection pieces before, then this is a really, really good piece of paper to have with you. We'll send you the links for this as well. But print this out, just have a few copies on your desk at home or on the kitchen table at home. And when you come home from that work experience, just spend like 5 minutes just filling this out, and just keep them somewhere, put them, as long as it's written down and you've done that, within a day or two of your work experience, you've got something to reflect on. And you can come back to all these sheets of paper when you come into your personal statement, and when you come into interviews, you can be like, oh yeah, I did see that actually. And yeah, that's how it made me feel at the time. And it brings it all back to you. And that's the gold that you use inside your personal statement and interviews. So I'll send you the link to this. If you do anything at all this evening, just save that link somewhere, or print some copies off and put them to one side somewhere so you can use them later, because this will be really, really important for making the most of your work experience this summer. If you do anything, just do that one thing tonight. That'd be really good.
For sure.
Cool. Yeah, I think that's the last slide, isn't it? So we'll probably get to question times now.
Let's do it.
I think before we go into all the questions, all those documents that I shared, I'm going to put them inside the chat so everybody can access those now. So if you just give me 2 seconds, I can post them straight into the chat. So the work experience email template, I will put that in there. There was the call template as well. I'll put that in there. And then there's the reflection sheet as well. Yeah, cool. So all those 3 documents that I showed you, they're all there. You can download them all completely for free. They're all there. And I know that we touched on the work experience point before as well. So I'm going to include the link to our ward round live as well. I'll put that in there as well. So 4 links, 3 of them are documents. 1 is our ward round live course. This is my 2 minutes to promote our ward round live course, if anybody does want to do that. So again, I'm just going to quickly share my screen if I can. I can find the right buttons, I will. Sound. So this is just a quick video of our ward round live course. If anybody does want to find out a bit more information about the about that, can you see that? Cool.
Are you thinking about applying to medical school? Hospital-based work experience is often the most desired, but also most challenging type of work experience to find. Most hospitals have age restrictions and very limited spaces for aspiring medical students. And even if you are lucky enough to gain a hospital placement, you can be paired with a doctor who is rushed off their feet and doesn't have a great deal of time to teach you. Our Ward Round live course solves all these problems for you. We have our own hospital ward, and we can live stream real medical cases straight to you. Our doctors will teach you how to speak to patients, read medical notes, interpret observations, and form treatment plans. Then, it's over to you. You will be speaking directly to patients, reviewing their notes and charts before making decisions about their treatment, all supervised by our friendly NHS doctors. Gain the experience and insight you need for your medical school application. Have plenty to write in your personal statement, and stand out at any medical school interview. Join our Ward Round live course today.
Cool. There you go. That's the Ward Round live course. If anybody does book the Ward Round live course like this evening, they think that it's great and you want to join that, you want to get some of your work experience booked in and done, check out that Ward Round live page on the website. And especially for those year 12s, if anybody books that Ward Round live course kind of this evening, we'll give you a 50% off our UCAT crash course as well. So if you want to get your work experience booked in and you want to get some of your UCAT prep booked in as well, if you book the Ward Round live course tonight, we'll send you 50% off for the UCAT crash course as well. So that's a half decent offer for tuning in on a Wednesday evening. Cool. That's our work experience bit done. Should we go to some questions?
Let's do it.
Right. Okay. So we'll try and get through as many as possible. Try and use the Q&A feature if you can, rather than using the chat, because we'll be using the Q&A bit rather than the chat to answer the questions. Cool. So if you have attended many webinars about getting into medicine, how do you say this without just listing lots of things that you've watched?
I'm gonna say the word reflection. Yeah, so I think, I think what medical schools want to hear is, I don't think they're after the amount of hours that you spent doing work experience and watching webinars. I think they just want to know what you've gained from it and what you've learned from it and what you're going to take away from it. So I think just picking out something that maybe you found really interesting from one of the webinars, or something that you thought was quite eye-opening and that's changed your perspective on something, or just anything that you can reflect on, then I think that they would really like that, rather than, as you say, you don't want to just list, just pick out a really good bit, really good juicy bit, and reflect on that, and that would be great. That'd be more than enough.
Yeah, I think just saying something like, I've been watching an entire series of webinars on the medical school application process. This bit really got me interested, and this is why it got me interested. And then I went off and read this and did this. Like you can say that you've done a lot in a very short way. You don't have to list everything. So hopefully that helps. How do you reflect on a book that you've read about medicine? Pretty similar, I guess.
Yeah, it probably is really similar. Like, don't just, I think, just talk about one of the messages of the book, about what could be how we approach ethical situations in medicine, and then what you learn about that, and maybe just try and link it in with something else that maybe you've done, or it's all about being clever with how many characters you've got as well. It's quite hard, but it's just using that structure as much as you can with something that you found interesting, really.
It's all about reflection, whether it's the work experience part, whether it's the books, whether it's webinars. It's using that table that we gave you to reflect on it properly, and then just dropping those like little nuggets of reflection in when you need to. But start using that table as a stepping stone. Go and watch some of the old webinars where we'll talk about reflection, and that'll give you a bit more detail on how to reflect on books as well. We've also got a really good blog about how to reflect. So if you use those tools and you read and you study those tools, you'll be ready to apply it to whether it's books or webinars or anything. Next one is from Katie. And when should we begin to write our personal statement?
Ooh, I think you do want to give yourself plenty of time because you are going to go through many drafts. I think I went about through 14 drafts of mine before I sent it off. But I think don't rush into it. I mean, I think you still got time. You still got to get work experience over summer and things like that. And there are more things that you're gonna do to add to your personal statement. So don't do it now because you haven't got everything ready and prepared. But then also you don't want to leave it till mid-September or October when the UCAS deadline is. So I'd say maybe start having a think about it over summer. You don't have to have a finished copy by July or whatever. But yeah, maybe having a good go before you go back to school in September, and then your teachers are probably going to maul it like they did with mine and just go. But I think as long as you have a really good go and have something to show them and say this is what I want to write about, then that's really good. So maybe start in July, August, and then, but September you will be changing it a lot.
Yeah, or at least be making the notes for it.
Yeah, definitely.
Make sure that you're filling out the reflection sheet. Like as soon as you start getting your work experience, start filling those notes in, start filling those sheets in. Because then when you get to the end of summer, when you get to the start of September and you sit down to write it, if you've got a stack of those sheets, oh mate, it's going to be so much easier.
Yeah.
Rather than having to think, oh, right, what did I do back in May? Right, what patients did I see? What did I learn? Start the notes as soon as you start your work experience, and it will make everything else much easier. Next one down is from Maisie. How much volunteering do you suggest we do?
So I don't think it's necessarily the amount of hours. I think they like to see some kind of like long-term commitment, so that you've stuck with it for a while. So maybe just I only did I think 2 hours every other week, but I did it for 2 years. So I was in that job for a while. So I think just get started as soon as you can, and I don't think there's a set amount of hours. They just want to see that you stick with it and you're committed.
Yeah, and again, what you reflect on it from.
Yeah,
like I think every single point's we're gonna mention reflection at some point, but you can have 2 days volunteering and reflect really well. Yeah, you could have 2 years worth of volunteering and not reflect very well, and there'll be one person that stands out better than the other. So learn to reflect.
Yeah.
We'll just say that for like every answer. We'll just type it, reflect. We'll just put a slide up that just says reflect, and then we'll go away for an hour.
Cameras off.
Can you do any science work experience in medicine if you can't find medical work experience?
Yeah, I think so. I think if it's something that you're really interested in. I think the thing is with medicine, because it's so different in that it's very much communication and people focused, as opposed to science. So I think maybe being able to reflect in how you worked in a team in that environment, worked with people with different roles, and I think that was really good, as long as you can relate it to medicine and how medicine works, and as well how medicine works, and you've at least read up on how the NHS has kind of worked, what people's roles are, and then can link it in with the science work experience that you've done and reflect on that. Then
reflect.
Then you'll be fine. So go for it.
What is the best way to make the use of the holidays to boost your medical school application?
So
all of the above.
Yeah. Yeah, work experience. Read some books as well if you want to. There's loads out there that are really good. I think Goodreads probably has a really good list of like medical-y type books. Just start practicing for UCAT as well. Maybe try getting stuff down for your personal statement. Just all those things. Just just do a little bit as you go along. Don't just leave it all till, the end of August when you're about to go back.
Yeah, definitely. This one, how does online work experience, or how is online work experience seen by medical schools? We speak to the medical schools regularly, and they've been really understanding this year about the fact that you can't, or you haven't been able to just go into the same GP practices and care homes and things, and they're absolutely accepting online work experience. Again, if you can reflect on it in the same way, if you're somebody that's attended an online work experience course and you reflect on that really well, and you have somebody else that's had tons and tons of shadowing experience even in hospitals and things, but they don't reflect on it, your application is going to look better than theirs, it's going to read better than theirs. So medical schools are absolutely accepting online work experiences. Get as much as you can. It's so accessible, it's amazing, and just learn to reflect on it really well. Yeah, cool.
Agreed.
Is a pharmacy placement good work experience for medical school?
Yeah, I definitely think so. Yeah, I think you're working with the same patient population. It's the, we have pharmacists in the hospital as well. There's a lot of crossover there. Maybe just thinking about maybe like how you tailor your approach to maybe people with different illnesses, or if you're giving drugs to some like a someone who has a different type of illness where communication is difficult, maybe reflect on that. There's like loads of things that you can talk about with working in a pharmacy, because there's so much crossover with medicine. So I think it's really, really good and like a really beneficial thing to do. So reflect on it as well.
Is it okay if you have only got online work experience and volunteering?
Yeah, I think so. I think double just check on the university website as well, that that's that they'll accept that, and I think it's fine. I think all of them, well, most of them pretty much just know how difficult it is at the moment. So as you said earlier, Mark, that they're being more lenient, and they know that this online stuff's great. So
yeah, honestly, I know I'm biased and we have online work experience courses, but genuinely, because you have a bit more time and it's controlled in a structured way, and you have time to talk through medical cases fully. If you go and get work experience at a GP, and that GP's got 10 minutes to basically, speak to the patient, diagnose the patient, do any notes, all the things a GP needs to do, and then explain the case to you. That's really difficult for a GP. But the online work experience, you've got time, and the GPs and the doctors aren't under that time pressure. And you can sit and have a 20, 25-minute conversation about that medical case on our courses, and be like, well, what does this mean? And ask all the questions that you want to ask. So yeah, it's an incredibly valuable kind of tool. And I think that even when work experience goes back to normal, I think this online work experience will hang around because of the accessibility and the quality and the time that you can actually get with doctors is really good. So yeah, it's just a follow-up point on that. There's a question there about the Bmat. We'll do a separate one about the Bmat. We'll leave that one out. So I'm not ignoring it, even though it's the top question at the moment.
I didn't do it either, so I wouldn't, wouldn't know.
Yeah. Katie's asked, how should we get work experience if we don't know any doctors? Well, all of those application things that we said before, in terms of writing emails to GP practices, calling GP places up, care homes, hospices, hospitals, all those slides at the start, that's how you get the work experience. You just have to go through that process, and hopefully we've given you the tools to be able to do that in a really easy way. Cool. Probably take about 5 minutes more questions. We don't want to take up kind of too much of everybody's evening. I'm going to scroll down and see if I can find some questions that are slightly coming later on as well. I plan to take a gap year, and I was wondering what counts as a productive gap year. I plan to have a full-time job and do some volunteering. Would that be enough?
Yeah, definitely. I think, that's great. And I think that the volunteering, the working is really important. I think that, it's all great. Some people go traveling for a year, but I think that, doing those roles and being committed to those roles for a whole year they'll be, really impressed by that. And yeah, I think that's a great way to do it. There's not much more you can do than that, especially with how it is at the moment. Whether it'll be back to normal-ish, hopefully next year, I don't know. But I think that sounds like a really good plan, and as long as you can reflect on it, then even better.
We've got some questions about CVs as well.
Mhm.
I purposely didn't put a full guide on how to make a CV in this because it would probably take us half an hour to go
Yeah.
through a CV. There's lots of really, really good templates for CVs online anyway. But if it's something that people want to do like a specific webinar on, maybe let us know in the comments or something. But yeah, have a Google for CV templates. There's some really, really good ones that you can literally just copy. What is the minimum amount of work experience required? Well, don't aim to do the minimum to start with. That would be my first comment, is don't aim to do the minimum.
Yeah. I don't think that, especially this year, I think, yeah, they'll be really impressed if you've got some stuff there. So, it's hard to say what a minimum is, but I think if you've got enough that you can write about, if you can write a whole personal statement, well, not a whole personal statement because you've got other stuff to include, but if you can write a solid personal statement with work experience in with what you've got, then I think you'd be fine.
This is quite a good question. I know our entire webinar is about work experience over summer and how to make the most, but is there anything other than work experience that we can be doing during the summer? So work experience isn't everything. There's other things that you can do to help with your medical school application during that time. Or what do you think you'd suggest?
Yeah, I'd just say get cracking with the UCAT practice. I think that's that for most people, that's the biggest hurdle, I think, to getting into medical school, is that one exam, or Bmat if you're doing that. So I just say just start early and do a little bit every day, 15 minutes, half an hour of practice. I think that's always really useful. But the thing is as well, I think enjoy your summer as well, because you don't want you to get yourself burnt out as well. So go camping or something as well, because I mean that's just as good, and then you'll come back refreshed for your second year of sixth form college and ready to go, ready to do your application, because it's a stressful time, that September October time where you're sending off your application and then you're going to interviews. It's just so you do your work over summer, work experience stuff, but enjoy it as well. I think that's really important.
Yeah, I think it's a really nice comment to end on as well. Is yes, work experience is going to be important over summer. Yes, your UCAT is going to be important over summer. Take up that offer. Go and book your work experience tonight. Book your UCAT practice tonight as well. Get it all done, but then enjoy the rest of your summer and actually, enjoy yourself as well, because like you say, as soon as you go back in September, you're going to have so much to do on top of all of your A levels and everything else you've got to do. So if you start preparing now, and the fact that you're on this webinar this evening tells us that you are prepared, that's awesome. Get things booked in, get it planned out, and then plan a week or two off during summer. As long as you're not rushing around trying to fit things in, you'll be absolutely fine, because you've done your planning at the end of April, which is awesome. So I think that's a really good point to kind of end on. Be organized now, and then you can have a couple of weeks off during summer.
Enjoy yourselves.
Yeah, cool. Thank you very much, Minnie, for joining us again this evening. We really appreciate your input as ever. I will send a copy of all those links as well that we sent out. If anybody wants to go into the chat and copy those links now before the Zoom chat disappears, I'll give you a couple of minutes just to copy those links from the chat, because as soon as we close Zoom, they'll be gone. We will send a copy of the slides to you, and we will send a recording of the webinar as well. So if there's anything you want to catch up on, you can watch all of our beautiful faces back again. Cool. Right, that's it. We're done for this evening. Enjoy the rest of your evening, Minnie. Enjoy the rest of your evening, everybody else. Thank you very much for joining us, and we'll see you in a couple of weeks on the next webinar.
Bye, everyone.